Hey everyone, I'm Dr. Karr and I'm here to help you make smarter choices to live a healthier life. Today I'm going to be talking about free versus total hormone levels and why that really matters for your health. So to back up, a few months ago, I had a friend reach out and he was asking for me to give a little bit of an interpretation to his labs, specifically his hormone levels. He has his testosterone checked. And what we noted at the time is that even though his total testosterone was within normal limits, his free testosterone was low. And I asked him, I said, did they measure your SHBG or sex hormone binding globulin or your albumin levels? And he said, no. And it made it, again, it's pretty difficult to interpret the labs without that. I had some personal experience with this. This was about 6 years ago. I was feeling off, just fatigued, didn't have a whole lot of energy, wasn't sleeping very well. So I decided to get my hormone levels checked. And what I noted at the time is that even though my testosterone was within normal limits, or at least my total testosterone, my free testosterone was actually really low. And the culprit in my case was a very high level of SHBG. Now, at that time, I was practicing or adhering to like an OMAD 1 meal a day diet, as well as really limiting my carbohydrate intake. And so it just got me thinking that this is something I've seen come up over and over. You watch videos on YouTube and they'll talk about testosterone levels and what ideal levels are, but usually they're referencing the total testosterone. But what's really important is that we need to understand what your free testosterone is, because that's the actual amount of hormone that's available, that's bioavailable, that can be used by your body for the things that those hormones are designed to do. So what is the difference between free and total hormone levels? So I like to always think about things in terms of analogies. I just find it's helpful. It helps me to remember. I think it's helpful for patients to understand the concept. And so when we're talking about hormones, when we talk about your total hormone levels or total testosterone levels, really the way to think about it is your net worth, right? So it's everything you have. So it's investments, it's all your assets, it's things you have in a savings account, and the cash you have in your pocket. So that's your total hormone level. Your free testosterone level is really the cash that you have available to spend. So pretend you don't have a credit card, but just the actual cash in your pocket that you can spend in that moment. So total testosterone, or estrogen for that matter, tells you how much hormone exists in your blood. But free testosterone is what's actually available for your body to use. And here's the problem. Even if your total hormone levels are great, if your free hormone levels are low, you can still experience symptoms like fatigue, low libido, or difficulty building muscle. So SHBG and albumin, think of them as kind of like the hormone lockbox and your bank account. SHBG, or sex hormone binding globulin, is the lockbox because it binds really tightly to testosterone and estrogen, locking them away so your body cannot use them. Albumin, on the other hand, is kind of like a bank account. So the money's there, the hormone is there, and it's accessible, but it's not able to be done without quite a bit of work. So together, SHBG and albumin regulate your free hormone levels. And when SHBG levels are high, free hormones drop, even if your total hormone levels are perfectly normal. So what influences SHBG levels? The first one I'm going to talk about is insulin resistance. So as insulin resistance goes up, it actually decreases your SHBG levels. And you may say, well, that's great. But when you think about it, it's really not, because if the way you're getting there by lowering the SHBG is by having increased insulin resistance and kind of getting on that road to diabetes, I don't think that's a trade-off that's really worth it. The next is chronic stress or cortisol. As our cortisol levels rise, SHBG actually decreases. But again, that's not really a trade-off I'm willing to make. I'm not willing to be more stressed in order to have lower SHBG and more free circulating testosterone. In terms of thyroid hormones, hypothyroidism actually lowers your SHBG levels, and hyperthyroidism, or elevated levels of thyroid, increase your SHBG levels. Estrogens and androgens, so estrogen actually increases your SHBG while testosterone lowers it. And lastly, liver health. If you have liver dysfunction, that's going to result in lower levels of SHBG, which is ultimately going to have an impact on your free hormones. So why does SHBG matter for men and women? So for men, high levels of SHBG are going to result in lower levels of free testosterone. And that's, again, the similar situation that I was in, that I was describing in the beginning, where my total testosterone was within a normal range, but unfortunately I had so much SHBG, it was binding a lot of it up, resulting in very low levels of free testosterone. Alternatively, low levels of SHBG are going to result in more free testosterone, which, what I was looking for at that time was a desired effect, but it can also go too far in the other direction. This can also cause some potential hormone imbalances. For women, high SHBG is going to worsen estrogen dominant symptoms, cause things like PMS as well as fatigue. Alternatively, low levels of SHBG are going to result in more free testosterone. This can contribute to things like PCOS or polycystic ovarian syndrome, acne, as well as hair loss. So whether you're a man or a woman, SHBG plays a massive role in how your hormones actually function and not just what your lab report says. So how do diet and lifestyle impact SHBG levels? Firstly, and this is again something that was an experience I had, is fasting and having low carb diets, very low carbs, can result in increased levels of SHBG, which can reduce your free testosterone too much. Again, that was my experience. Alternatively, high carb diets can lead to insulin resistance, which is going to decrease SHBG, and that can sometimes increase free hormone levels too much. Protein intake can help balance SHBG levels, especially in low protein diets. And lastly, alcohol and liver health. Poor liver function lowers SHBG, impacting your body's ability to balance your hormones. Your lifestyle and diet choices are directly affecting how much of your hormones are actually working for you. So what are the best strategies to optimize your free hormone levels? First, you want to really manage your insulin sensitivity. You can accomplish this by making sure you're eating a healthy, balanced diet, especially with healthy carbs, as well as strength training and exercise. Secondly, you really want to reduce your chronic stress. So anything you can do to help to reduce your cortisol levels is going to be important, and this includes getting good sleep, relaxation, and mindfulness practices. Third, you want to make sure that you've optimized your thyroid health, so ensure you're getting proper iodine, selenium, as well as having your thyroid levels checked. Four, you want to make sure you've got a healthy liver, so anything to improve your liver health. This would include limiting alcohol and supporting detoxification with proper nutrition. And fifth, just make sure, again, you get the right tests. So free estrogen and testosterone, total estrogen and testosterone, SHBG, albumin, and your thyroid levels. So my closing thoughts on why free hormones matter. Your total hormones are just part of the story. Your free hormones, the ones your body actually uses, are what determines how you feel. If your symptoms don't match your results, you need to look deeper. Get your free hormone levels checked, make sure you optimize your lifestyle, and work with a professional who understands the full picture. Again, going back to my story in the beginning, for me, it wasn't a matter of me needing to go on testosterone replacement. It was really a matter of me having to modify my diet as well as doing some things to reduce stress to really help to lower those SHBG levels. I hope you found this video helpful. Again, I'm Dr. Karr. I'm here to help you make smarter choices to live a healthier life. If you did find it helpful or you have any questions, make sure you can respond in the comments section as well as hit like and subscribe. Thank you.